No, we didn't wait on Washington when we decided to close the Medicare donut hole. We couldn't wait on Washington when we decided to expand health coverage to 161,000 Marylanders, 78,000 of which are children living in low-income households. Instead of waiting for Washington to act, we chose to provide small businesses with the incentive to do the right thing and to offer affordable health coverage to their employees. We couldn't wait for Washington when we decided to invest in reentry and behavioral health services to the men and women who fight for our freedom when they put on the uniform and go to Iraq and Afghanistan. When they come home, we're there for them. We couldn't wait for Washington to advance health IT. We couldn't wait for Washington by allowing young people not to be covered on their parents' health insurance. We did that first in Maryland, and we're only more excited that the federal government has stepped up to do the same. No, we couldn't wait. But because of reform in Washington, and because of the difficult choices that we've made in Maryland, we anticipate that national health reform over the next 10 years is going to save us $1 billion right here in the state of Maryland.
And is that this is an incredibly appropriate time to get this done because, today's the second day of Passover. Passover is a holiday that celebrates liberation. What is health reform if not our liberation from the tyranny of the insurance industry? On Sunday is the holiday of Easter. Easter celebrates rebirth. What is health reform if not the rebirth of America's promise of liberty and justice for all? We were able to get this done by having the largest grassroots movement in the history of this country.
It takes me back about a year ago when I decided because of health reasons I needed to resign from my executive level position. Much like today, you can never plan for unexpected accidents. When I resigned from my job last July, I knew the one thing that bothered me the most was health care, that I would not have it for my kids and myself. You see, about a year and a half ago, I suffered a mini stroke at the age of 44. And so I needed ongoing health care, but I knew that the position that I was working in at that time was going to be detrimental to my health as well. So I had to make the very hard decision to leave, praying that the Lord would just open doors for me, but not having an idea that He had already made provisions. My son is a lacrosse player as well as a big-time football player. And Jimmy had taken many knocks to the head. And so one night he was dealing with really, really terrible headaches, and I needed to get him to the hospital, from the football field to the hospital, knowing that we did not have any health care. For me, that was a new adventure because after 20 years of being on an executive level track, I did not know what it meant to not have health care. Did not even begin to fathom what that would look like. But I knew that I had to get my son in. It was very scary. And for a moment, I thought about it. Aspirin, hospital. So, being the mom that I am, I took him to the hospital, not really caring about what the results was, knowing that I would have to work it out. Jimmy had to go through extensive tests. He had CAT scans in my eyes to his head, and gratefully today he stands here healthy and still playing lacrosse. But what I found out was that Jimmy was very eligible, along with my daughter Brianna, was eligible for health care. I too thank the O'Malley Brown administration for our lives, because not only did I find out that my kids could be covered under this new Governor's Working Family Act, but I found out that I could. So not only my ongoing health care for my mini stroke, but what I found out later was I had developed lupus. So I am very, very grateful to stand here today, Lieutenant Governor and Governor O'Malley, to say that you had a tremendous impact on my health care and my family's health care. I am a living testimony to what this health care reform, this expansion can do for families all across Maryland. And I thank God that I am one of 55,000 people who are now getting it, but I will lead the charge in my neighborhood, in my community, for us to just keep on moving forward on this because it saved lives, and I'm here as a living testimony. Thank you for your time.
And I'm self-employed. I'm a diabetic and an asthmatic, and I'm without health insurance because I have been denied health insurance by 3 major insurance providers because of my pre-existing conditions, that being diabetes and asthma. I also was denied health coverage by the Maryland Medicaid because I did not qualify. This forces me to use the hospital's emergency room as my primary care physician. I am happy to have this opportunity to express my frustration in my inability to obtain health insurance coverage. I would like to thank President Obama for taking on this arduous task of health care reform. I'd like to thank also Governor O'Malley, Lieutenant Brown, and this administration for allowing me to share with you today. Thank you.
Heavy lifting has been done in Washington, but the true work begins right here at home. Because when it comes to implementing health reform, it's only going to be as good as the work that we do in the state of Maryland. And that's true for every state around the country. We've got a lot of work to do. We have to continue rolling up our sleeves, fighting to make that 3-legged stool of health care that much stronger, improving quality, expanding access, and driving down the cost of care so that every Marylander has access, that right to health care.